and more importantly, it shows up in real patients. In this video, we're breaking down one of the most high-yield lab patterns in coagulation testing. Not just what the right answer is, but why it matters, how it affects real people, and what physicians do with that knowledge. Let's dive in. Here's a multiple-choice question, just like you'll see on the exam. A 10-year-old boy presents with joint swelling and a history of frequent nosebleeds. His PT is normal, but his PTT is prolonged. Which of the following factor deficiencies is most likely? A. Factor 7. B. Factor 8. C. Factor 10. D. Factor 2. Take a second to think, then we'll break it down. Let's talk about what PT and PTT actually test. PT, prothrombin time, checks the extrinsic and common clotting pathways. APTT, activated partial thromboplastin time, checks the intrinsic and common pathways. So if PT is normal, the extrinsic pathway is probably working fine. That means factor 7 is likely not deficient, so we can cross out answer A. Now let's look at the common pathway. It includes factors 10, 5, 2, also known as prothrombin, and 1, which is fibrinogen. A deficiency in any of those factors would usually prolong both PT and APTT. Our patient only has a prolonged APTT, so we can eliminate answers C and D, factor 10 and factor 2. That leaves us with factor 8. Let's take a closer look at why that makes sense. Factor 8 is part of the intrinsic pathway. It works closely with factor 9 to activate factor 10 and continue the clotting cascade. If factor 8 is missing, the intrinsic pathway gets disrupted, and that prolongs the PTT. But because factor 8 isn't part of the extrinsic pathway, the PT stays normal. That's exactly what's happening in this case. These lab results point directly to a factor 8 deficiency, and there's a name for that condition: hemophilia A. Hemophilia A is one of the most well-known inherited bleeding disorders. It's X-linked recessive, which means it usually affects boys and is passed down by female carriers. Classic symptoms include bleeding into joints, easy bruising, and frequent nosebleeds. In this case, our 10-year-old patient has textbook symptoms: nosebleeds,